Well, welcome everybody to the LifeWest Leadership Line. Today I have a leader in our profession and a very close friend of mine, Dr. Carlos Bogosian. Dr. Carlos is the president of the Federation of Chiropractic Licensing Board. So Carlos, welcome to the LifeWest Leadership Line.
Thank you, Ron. Thanks for having me. It's great to be here.
It's funny, man. You know, looking at you, I feel like I'm looking at me, you know, and for our viewers, you might see that we have the same barber. We actually meet. He's in Connecticut. I'm in California. We meet once a month in Kansas City or wherever we choose, middle of the country. Get our heads done and boom, and then we're out. But it's so good to see you, and it's so good to see your hairstyle. I feel at home.
Hey, Ron, good to be here. I'll tell you one thing for sure. We don't need any lights or flashing here right now for both of us.
Oh, tell me about it.
Lighting.
It's great lighting. It's great. So welcome. Hey, let's jump into it, Carlos. You know, you're doing amazing things, and we'll share what the FCLB. Actually, you know, a lot of our viewers might even not know what the FCLB is, the Federation of Chiropractic Licensing Board. So, you know, why don't you share with us, you know, the history, a little bit of history, and you know, who you guys are, what you do.
Oh, thank you. Thanks for bringing it up, Ron. Listen, the FCLB is the Federation of Chiropractic Licensing Boards, which really what we say is the premier international regulatory resource center for information to disseminate information to all the licensing boards and licensed chiropractors across the country and internationally. You know, it's interesting because the very first meeting of the licensing boards was held in 1919, and the FCLB was formed in 1926. And, you know, when you talk about history, you know, I always say that, you know, that we have some amazing organizations in chiropractic, and the Federation is one of those organizations that's been around since 1926. And when you know, one of the things I always say is that the rich history of our profession should not only be preserved, but also acknowledged and learned from. So when you think back about, you know, our pioneers, people who started in chiropractic and especially licensing boards, you know, their jobs were never easy. Their intentions and dedications were always challenged. You know, they didn't have the resources that you and I have here today. They didn't have the Zoom meetings, they have email, they didn't have phone. Yet, with strained personal resources and finances, they never forgot the reason for being. And it's because of their dedication, their passion, and their commitment that chiropractic gained licensure, state by lonely state, starting with Kansas in 1913 and Louisiana being the last one in 1974. In fact, I think California was 1922. That's when you gained licensure in California. And, you know, the same passion, the same commitment, and the same purpose is right now palpable in our current licensing boards. And because of that commitment, the FCLB has grown, and we're an international organization right now. We have 48 out of the 50 licensing boards are members, and we're continuing working to innovate ourselves and, again, bring the information that's needed for licensing boards, for licensed chiropractors to the profession to help them understand what regulation is and how they can really serve their patients.
Right, right. And people don't know that, some people don't know, some do, of course, but that it's the job of the state board to protect the public. It's what their job is. They're put on usually by the governor, right? And it's their job to protect the public. So they need to know about regulations. They need to know about you know, what is happening in the regulatory world, right? And these are usually practitioners. This isn't a full-time job. It's a volunteer job to be on a state board. So that's where you guys come in also, to be able to help educate them and upskill them and level them up to a place, you know. And I know this to be true right now because, you know, I'm in touch with our state board quite a bit, and California's got a very good state board. That, you know, one of the #1 reasons that practitioners are being, you know, taken to their board or being sued or whatever is for sexual misconduct.
It's true. Yeah, it's true. Absolutely, what you say is true. Absolutely. To serve on a licensing boards, it's a governor-appointed position. I think majority of states is the governor appoints the person to serve on the board. And ultimately, yes, our goal at the Federation is about public protection. So our goal is twofold. #1, to protect the public, and also to elevate the profession in the public's eye. So ultimately, everything that we do is about public health, public safety, and public trust. And yeah, there's, you know, common disciplinary cases that come up in front of, you know, licensing boards. And One of the common ones is sexual harassment. Of course, there's a documentation, and and you're right. Majority of the time when a chiropractor gets appointed to serve on the licensing boards, they might not know the in and outs of what it means to serve, and that's why the federation really we have. In fact, we have programs where we really retrain the new board members and how to be able to serve at that capacity. Because there are times that, Ron, it's the hardest thing to do to sit in the judgment of your own colleagues. Right. It's really, one of the toughest things in my opinion. I've been serving in the Connecticut Chiropractic Board for the past 5 years, and I tell you, there are sleepless nights because, when your colleagues come up in front of the board, you have to really take the evidence in front of you and be able to, decide what's the best thing to protect the public. And it is a thankless job, but again, there's a learning curve that goes with it, and this is where the federation really bridges that gap and helps. When the federation, we were an organization, we've been around since 1926, and every possible case has, there is someone within the federation, one of our licensing boards has seen it, and that's why it's a great resource center for us to share information and guide our colleagues to make sure that, yes, the patient is protected, but also the profession is protected.
Absolutely. And, I think the other thing that some of our more recent graduates, even graduates who graduated, 10, 15 years ago, and I know you're a 2004 grad, right?
Yes.
From University of Bridgeport, right, in Connecticut?
Correct.
Yeah.
Yes.
And I know that a lot of them don't. When I graduated in 1981, we only had two parts to our national boards back then, right? We had part one and part two. So when we went to different states to get licensure, I'm licensed in 3 different states. I had to go take individual state exams.
Yes.
So first exam I took was in Michigan, right? And I had to go there and do a test in Michigan. Then I did Massachusetts, and Massachusetts was more about, it was actually an interview in an office of someone on the board, right? And they actually wanted to see how I adjusted and what I did, and they just met with me like that. Then I went to California and took my test in California, and totally different. I had 5 or 7 different stations. It was a long exam. I had to do X-ray, had to do adjusting, had to do all these different things, and it was set up differently. And now where we're at, because the licensing board's getting together and that kind of thing is, now it's pretty much just jurisprudence because they take the national boards, and a lot of this we would have never moved out of that. If it wasn't for organizations like yourself that can help streamline and pull everybody together. And I think that's really important.
Well, it's true. And, Ron actually was the FCLB who commissioned the very first study to come up with a national chiropractic examining organization. So it was, as a result of idea of trying to unify and standardize the licensure process, it started with the FCLB's study. So, and it's true now because of, the 4 parts of national boards, again, it gives you that jurisdictional mobility. It allows you to, obviously, depends on when you got your licensure. But
yeah, exactly, exactly. But I will tell you this, and it's really interesting because I know that the FCLB, yourself and your executive director, Dr. John Schwartzmeyer, I know that and maybe your staff, you guys go to meetings with other regulatory boards, right?
Yes.
Medical, dental, whoever else is out there.
So, the Federation, and we're a member of the Federation of Association of Regulatory Boards, which basically it's an organization where the sister company or organization like the FCLB are members also. It could be, the architects, it could be dentists, the medical boards. So, which is incredible because, when you start looking at how other professions are regulated and why was regulation placed in the first place with the intention of public protection, you see that there is a lot of similarities in there and a lot of information that we learn from other boards and our association helps us disseminate that and, come up with innovative ways of, again, helping our boards to get through, things change. I mean, one of the things that coming up right now is a big hot topic is telehealth. So, I mean, telehealth is a growing industry. It's, I think, it was in 2016 or 17 was a $26 billion industry, and now it's grown to be even up to 25% increase in that. So these are as you look into the reason when we attend those meetings helps us to bring that same information and disseminate that into the chiropractic regulatory world.
Yeah, and it really just up levels our profession is really what it does, and it's so important. And so let's move it. And thank you for that history, because I think a lot of our viewers have no idea, and it is important, right? Because we're all subjected, not to, but with our state boards, right? And they could be our friends on the boards. I have friends on our board, and it's but they still have to do their job, like you said, and they have a really good overview and get to learn a lot from the FCLB, right? That umbrella that they have, so to speak. But let's talk about some initiatives, because I know that the FCLB, besides that, has their own initiatives, right? And things that you're doing, right? I know like one of them is like Sinbad, right? And the other one is the PACE program, right? So share with us a few of the things that you're doing, that FCLB is doing for our profession.
Sure. I mean, the Sinbad is the Chiropractic Information Network Board Action Data Bank, which is pretty much it's a system that's actually recently was upgraded, which allows chiropractic licensing boards to register the licensees list in the system and get immediate updates whenever there's an action on a licensee across the board. So, which is very powerful in the sense that I even share this with a lot of chiropractic colleges, Ron, and presidents. I say, if there's a recent grad who's looking to apply to work for a chiropractor's office, they can run that office into the Sinbad program and find out if does the owner of practice or anyone else in the practice have anything in our licensure. So or even when colleges are looking to hire somebody, it's a powerful system that's probably was our very first initial initiative, and it's been really super helpful to reduce the administrative burden on the licensing boards.
Right. So that's open to anybody to go and look at.
There's a nominal fee, but again, you can. I know colleges or organizations, they can choose to receive the annual membership, or they can be per use fee. So it's very nominal fee. If you want to run someone's license on that system, you can do that.
Right. And so do they find it on the FCLB website?
Yes. So if you go onto the FCLB website, www.fclb.org, you'll be able to use that service there. Yes.
Perfect. That's awesome.
Yeah. Another one of our initiatives, Ron, has been our resolutions. In the past decade, our delegate body has adopted 8 resolutions, and two of which have been very relevant, especially in the past years. One was in 2017, the delegate body adopted the pediatric resolution, chiropractic pediatric resolution, affirming that doctors of chiropractic are trained to evaluate patients of all ages, and that chiropractic care is safe for children and infants and everyone in between. So that was something that was adopted. It was very powerful. In 2019, our delegate body adopted the opioid resolution. And, I know right now we're going to the pandemic, but we got to remember that the opioid epidemic is still there. It's just compounded with a pandemic. But, that was in our resolution, was very powerful, was very supportive of what chiropractors can do to, mitigate the opioid epidemic. And we have another really important one coming up, and that is was supposed to come up for a vote during our 2020 annual conference, but unfortunately the conference was canceled. And that's going to be an extra resolution that we've had significant amount of support from many of our delegates. It's going to come up for a vote, and we're looking forward to get that adopted. And I've had the opportunity to travel and talk to a lot of the experts within the chiropractic profession pertaining to radiology. I had an opportunity to meet with Dr. Yoakum, and he's been very supportive of the resolution. And we're looking forward to bring that up for a vote and get that adopted, obviously. And I have to tell you, probably one of our most, I would say the crown jewel of our initiatives is our PACE program, which stands for Providers of Approved Continuing Education. You see, we entrust the CCE and the chiropractic colleges to fulfill their regulatory requirements for a DCP program. But once we graduate from school, Ron, there is no oversight in that. There is no quality control over that, and that's where the PACE program, fills that gap.
Right. And I think if our just let our viewers know the behind the scenes. So what PACE does, it actually, I can take a license renewal program and I can put that through PACE, and PACE vets it, right? And then puts it and then sees what states it can go to. And then if I want to do a license renewal program, I can actually get credit, or people from those states can come and they can get the credit through PACE.
Yes.
So it makes it easier for even for Life West. If we're doing, we're doing a license renewal program, we have online license renewal. If someone comes from West Virginia, we have to then make sure that we're approved in West Virginia for that program. PACE takes care of all of that.
Absolutely.
So everything does. So it's kind of like a clearinghouse almost for all of the states, and it's a really great thing, and it allows license renewals, people or continuing education, online continuing education, or in person, allows that to take place really, really well, right?
No, absolutely. I mean, the PACE program is really there to ensure quality. That's correct. So, the way we prove a provider is this. Basically, we know if you're a good instructor, it doesn't matter if you're teaching anatomy, physiology, neurology, or spinal adjusting. So as long as we can qualify the provider, then everything they're teaching could be qualified also. Yeah. And, that's why PACE bridges that gap. And that's basically how it's done. So, how do you ensure quality provider? Well, in order to become an approved provider, the applicant has to go through a committee that's made up of 28 members from academicians from chiropractic colleges, practicing chiropractors, and they are checked against 100 criteria before they're approved. Criteria like their course syllabus, how do they check their timekeeping, and how they make sure entry and exit of the person sits in the classroom or online classroom. So there's a host of other things that we check before a provider is approved.
Right.
And there's a very rigorous process that, the applicant goes through. And that's because of that really rigorous standards right now. We have really 39 jurisdictions who have adopted the PACE program in their regulatory statutory or rules and policies. And, that's numbers growing. And I have to tell you, even right now, in spring of 2020 compared to spring of 2019, we saw over almost 50% increase in licensed chiropractors who were taking some sort of course through PACE program. So it's been an incredible program. It's taken off again, simply because it ensures quality. And if a chiropractor wants to take a course, they can be reassured that the instructor that's PACE approved, the courses they provide is going to be quality courses.
Right. And they don't have to worry about taking license renewal and finding out it didn't cover in their state or it wasn't approved or that kind of thing too, which was just could be a waste of time for somebody unless the information is really great that they want, but they wouldn't go toward license renewal.
Yeah, and right now we have like 10 chiropractic colleges who are PACE approved providers. We have 12 state associations who are PACE approved providers, and obviously we have all the individual PACE approved providers. So yeah, just not to mention the record keeping aspect of it is very powerful because you might get a call, or a state association might call from a chiropractor who says, "Hey, listen, I took a course 3 years ago. I don't remember what the date was. I know it's raining. I don't remember the hotel name. Can you get my certificate?" So with this program, the provider doesn't have to deal with that. The federation has that record in our system for eternally, and all we can do is just provide that for the licensee. So it's
which is a big help, especially for people like us who are when we do a lot of license renewal and things like that. So a lot of it. One other thing I wanted to share with you, I would just like you to share with the viewers, and which I'm just going to bring up, and I'm not sure where the FCLB, I know that you guys started this, the travel to treat program, right? Like, yes. being able to go, for instance, if I want to send our Sports Performance Institute over to another state to take care of people, right? And a lot of our doctors might not know that either. Like if you're taking care of a football team or a sports team or a high school team, and the high school team in California has a convention, it has a tournament in Las Vegas, right? So you go to Las Vegas and you adjust the kids there, or whatever it is, the athletes. It could be illegal to do that because if you're not licensed in that state. So share with us how that works. And I know you guys were a big push behind it. Your predecessor, Dr. Maggie Colucci, was really huge doing that and doing some great stuff with that.
She sure did, and yes, absolutely. And one of our programs called the Passport Program was designed with that in mind. So again, that's one of the travel treat, whether it's sports or even if there was a catastrophe. So again, that's a program that's been it just started under her leadership. It's doing well, and again, Ron, all these programs one of the things I want to direct the viewership is to really go onto our website, and they can really learn about them. And there's so much work. Every one of these programs we're talking about, the previous leaders that have come before me, they put so much work into creating these things. And the Passport program is one of those really incredible that allows chiropractors who are teaching to be able to take advantage of that.
Yeah. And, if I went out right now and I talked to, 100 chiropractors and I said to them, how many of you know about the FCLB, right? Well, I'd say a bunch of them might raise their hands because they've heard the initials, right? Or the Federation of Chiropractic Licensing Boards. And then if I said, good, out of you that have your hands up, how many of you know what the FCLB does? I would tell you probably about, 80% of those would put their hands down, right? So because they don't know. And you guys are doing so many good things behind the scenes that you don't get the credit for, you don't get the spotlight, and that's what I wanted. That's why I wanted you on our show. But I wanted our viewers to really know what's out there, right? And where this regulatory body comes from and the things that are going on around that. So Carlos, I'm proud of the things that you're doing, and I'm more intimate, obviously, and I've been to FCLB meetings, but it's just amazing the things that the FCLB is doing. So thank you for all of that.
Hey, I appreciate it, Ron. Speaking of, behind the scenes, I mean, one of the things that happened during the pandemic is really when we came together as an organization with a lot of work. I know that our work with the pandemic started on March 17th, where we took an immediate and timely stance affirming doctors of chiropractic as essential healthcare providers. Now, I know that the majority of the profession probably knows that the Department of Homeland Security came out with a document on March 25th and identified and named chiropractors as essential healthcare providers. But here's a little fact that you may know about it, or I don't know if some of your viewers might not know about it. The Department of Homeland Security had released the exact same document on March 19th.
Right.
Chiropractors were not included in there. Yeah. So, in the initial few weeks, we were working super hard. We released a statement, and following that, we contacted so many governors, state officials, and Department of Public Health, asserting that, patients should have access to chiropractic care. And during one of those strategy meetings, one of our board members, Dr. Buchanan, he says, look, one of my patient's daughter is friends with Fauci's daughter. We said, well, listen, let's get a letter out to him through her. And, whether it was our letter, whether it was the advocacy of everyone else in the profession, but we know that, somehow that Department of Homeland Security changed their position. And ironically, a week later, the document included chiropractors. So, yeah, there's a lot of work. We had our COVID-19 task force that, I appointed some really, qualified people in there. They worked really hard. They reached out to the licensing boards. They asked them to extend the acceptance of online continuing education. As you might know, some states don't allow a lot of it. We asked them to maybe extend the license renewal deadlines, continuing education deadlines. We even asked them to offer concessions for license renewal fees. And a lot of licensing boards really follow through some of these guidance. And so I appreciate you, bringing that up because, there's a lot of work that's done behind the scenes. And really, ultimately, it is about public protection. But I know I heard this from one of my mentors in the regulatory world, and Dr. Bill Rademacher says you protect the patients by protecting the profession. So it is a lot of work that's done behind the scenes, and I appreciate you saying that.
Yeah, and we appreciate everything you're doing, and our viewers don't necessarily know that, so that's why I want you on the show so that they can understand and see what is going on. And next time they hear FCLB, they'll know what's happening. And please go to the website, www.fclb.org. It'll be on the bottom, and visit it. It's a pretty amazing website. Carlos, any last things you want to say as we close down our segment today?
Oh, thank you. Listen, our annual conference is coming up April 28th to May 2nd of 2021. It's going to be in West Palm Beach, Florida. I know we're looking forward to get together in person and actually meet everyone. So again, all that information, anything that you need to find out about the FCLB is on our website. And so please check that out. And Ron, I just want to really thank you. Your leadership and what you're doing is really a source of admiration. We appreciate you and keep doing the work that you're doing.
I appreciate that. Thank you, Carlos. And to our viewers, I just wanted to say that thank you for checking in with us every week, for listening to speakers and hearing our interviewees, share what they do, whether it's science, philosophy, art, politics, regulatory, things. it's just important to be educated and for all of us to constantly be leveled up on what's going on with our profession. So that's what we're about. We're about bringing you leadership. And once again, I want to thank Dr. Carlos for being with us today. And I want to thank you for listening and viewing us. And, until next week, stay safe, keep hugging the people that are around you and living your life, from above, down, inside out. So appreciate you so much. And we'll see you at the next Leadership Line.